few more joining as we talk. My name's Alan Simpson. I'm Professor of Mental Health Nursing at King's College London and Deputy Director of the Qualitative Applied Health Research Centre. And it's the QUAHRC, which is proud to be hosting this seminar today, the first of a series of seminar events that we're putting on. We'll also be live tweeting. The director, Vanessa Lawrence, will be live tweeting from the event. And if you want to check out our website, please do on www.QUAHRC, that's QUAHRC, always mess that up, at co.uk. And I'm very, very pleased to be able to introduce to you Dr. Michelle O'Reilly, who will be discussing and exploring the challenges of doing applied qualitative research. Michelle is Associate Professor of Communication and Mental Health at University of Leicester and a research consultant for Leicester Partnership NHS Trust, and she's a chartered psychologist. Michelle's been investigating the relationship between mental health and social media, including with adolescents, educationists and parents, funded by the Wellcome Trust. And she also has an interest in self-harm and suicidal behaviour and neurodevelopmental conditions and child mental health services, including family therapy. Michelle recently won the Anselm Strauss Award for Qualitative Family Research for her co-authored contributions on discursive psychology in this area. And today she'll be exploring with us the challenges of conducting applied qualitative research in a contemporary academic environment. We've just been chatting and Michelle says she loves nothing more to have a good rant. So I'm really, really looking forward to this session. Michelle, lovely to have you with us today. Thanks very much for coming along, and hand over to you. Thank you.
Thank you, Alan. We did test this out earlier, the whole sharing screen thing. So hopefully this is going to work. So fingers crossed you can see that. I always forget with Zoom when I don't know whether it's on your computers as well, but the strip of video always cuts off the right-hand edge of the slide slightly. But never mind, and I'll be speaking to the slides anyway. So and I'm sure that they can be distributed as copies to anyone who's interested in having a copy at the end. As Alan said, yes, I'm Michelle O'Reilly. I work at the University of Leicester and I work for Leicestershire Partnership NHS Trust. I've been doing qualitative research in various different settings and with various different populations, probably for just over 20 years. And during that time, I've seen various things change. The landscape of qualitative research has changed. The acceptability of qualitative research has changed. And I've worked with an awful lot of clinical staff in the NHS and clinical students who are training to be in the NHS using qualitative methods. And we've come across a whole range of different issues, challenges, barriers, but also some really wonderful, amazing things that you can do with qualitative research. So when I was approached to do this talk about the kind of generic challenges that applied researchers have in using qualitative methods for their research questions, I was really pleased to actually come in and have a chat. And it is going to be more of a chat. I don't want to sit here like an academic doing a really formal lecture style presentation. So there's going to be a real blend of kind of personal experiences, personal thoughts and opinions, along with some of the more kind of arguments in the field that I've been publishing on over the years. Now I'm hoping this slide is going to move on. I might just need my other keyboard to do so. Bear with me 1 second. Let's see if this works. Great. So just to give you a kind of general overview of the kind of things I'm going to be talking about, probably for about the next 40 to 45 minutes-ish, give or take. There are a huge amount of issues, arguments, ideas, theories, etc., that come up in the qualitative literature. Some of this you've probably been exposed to in your qualitative methods training and teaching. Some of it you will have come across in your general reading, and some of it might be a bit new to you because there's less written about some of these issues than others. And as I said, I'm going to give you kind of a personal and professional view of some of these things. But one of the biggest things that applied researchers face is this idea of evidence-based practice. So I'm going to talk to you a little bit about the ways in which qualitative research can be used as evidence in various fields like health and education and social care. The other kind of major argument that started to emerge quite a while ago, but hasn't really gained a huge amount of traction, but is actually nonetheless really important, is this idea of mixing methods. And when people talk about mixing methods, most researchers automatically think mixing quantitative methods with qualitative methods. But actually, mixing within the qualitative paradigm isn't as straightforward as some people assume it to be. And there has been quite a bit written about it. So I'm going to talk a little bit about the challenge of doing multiple method qualitative research. The other thing I'm going to talk about today is interdisciplinary research. So applied research problems are probably and arguably best solved through interdisciplinary research, where you have a research team that reflects a range of different training backgrounds, a range of different knowledge bases, and disciplinary thinking. And yet doing interdisciplinary research is actually quite a difficult thing to do. It creates quite a few challenges and tensions and problems. So I'm going to talk through some of those as well. I'm also going to talk about ethics because I love ethics. I'm the Deputy Ethics Chair for our university. I've done a huge amount of NHS ethics applications with clinicians. And it's a really fun thing to talk about. And actually, qualitative research brings up slightly different challenges when implementing ethics to perhaps some of the quantitative counterparts. Also going to talk to you about quality. So we recently published, I say we, my colleague Jessica Lester and I recently published a special issue because we were quite concerned about the way in which some of the quality indicators associated with certain methodologies were being talked about by reviewers in papers and by the kind of qualitative community generally. So we hoped to stimulate some debate and some academic engagement with ideas around quality and how we can assure quality in qualitative projects. And the last thing I'm going to talk about is slightly more practical, which is all around the politics of social science, which is things like funding bodies, journal acceptance and teaching, and the kind of the rhetoric that goes with that in terms of qualitative research. So that just gives you, hopefully, a brief overview of the kind of rants you can expect from me in the next 40 minutes. So a lot of my engagement with these different debates stems from the fact that I am an interdisciplinary researcher. And over the course of my career, that has created some challenges and barriers for me. I'm also a very qualitative researcher. I'm a big believer and big advocate of qualitative research. And that has also created some challenges and barriers for me during my career. And so they're really interesting debates to discuss. So I thought it would be useful if I gave you just a little bit of context about me and who I am and how I came to be sat here talking about these things and discussing them with you as an audience. And I am hoping that through your questions, you're going to make some contributions to some of these debates and use your intellect to kind of think about how we might solve some of these problems or how we are solving some of these problems. So just to give you some context, I work at the University of Leicester, but I work in 2 different schools. I work in psychology, and my background is psychology. So I work in health, developmental and social psychology. I also work in sociology for the university, where I do a lot more methods-based teaching, children and childhood and health and illness, sociology of health and illness kind of stuff. The other half of my week, I sit in the NHS for Leicestershire Partnership NHS Trust, where I work for the Child and Adolescent Mental Health Service, known as CAMS, which is part of the Families, Young People and Children's Directorate, i.e. the FYPC. And my main role is supporting and supervising clinical staff through their research and quality improvement projects. So I'm a quality improvement advisor, and I'm also a research consultant to support any clinician who wants to do either a small scale service evaluation right up to a big scale NIHR research application. And I also support people doing their NHS ethics applications because they're quite complicated and long to do. Just because I like to fill my time up completely and never have a spare second. I also work for the Open University, where I work in the Division of Education and the Division of Psychology, doing lots of research with children teaching. So you can see how my interdisciplinary spread really does go across, but I also do an awful lot of work with other fields like the School of Business and criminology and forensic psychology and social workers and so on as well. So one of the biggest challenges for applied researchers using qualitative methods is this very notion of qualitative evidence. And this is probably a term that you've come across. It crops up all the time. For people working in clinical practice, the basis of evidence is that they work under the guise of using best evidence to support and guide their practice. And this kind of argument around evidence has created some tensions for qualitative researchers, and the qualitative community has published quite a lot of work around what we mean by evidence, who the evidence is for, what the quality of that evidence is, and so on and so forth. And so it's created some tensions, and it wasn't that long ago in the BMJ that there was a special issue where some very senior scholars were complaining, I guess is probably the best word for it. They were complaining about the placement of qualitative papers in the BMJ and in medicine more generally. And a lot of that stems from what we mean by evidence. So if we take it historically, what's really interesting is that the very initial notions of evidence we're not concerned with qualitative practice at all. And the way qualitative evidence came to be was actually in a really positive way. And it's gradually over time that we seem to have lost our way a little bit in terms of what we mean by evidence and how evidence is used in practice. So it started with evidence-based medicine. I believe it was with paramedics and resuscitation, gosh, I can't speak. But the idea is that medicine ought to operate on standardized practices and best practice, and that there ought to be evidence underpinning the actions of medics in terms of how they do things. And gradually this idea took traction and it spread all the way across medicine. And the idea behind it was very, very honourable. We should be operating on the basis of best evidence for medicine. What happened was that kind of definition grew. And Sackett and his colleagues in the 1990s started to define what we meant by evidence. And they recognized that there are different kinds of evidence with different values and different approaches. And actually things like clinical judgment was a form of evidence because clinical expertise is really important in health and medicine. And that we shouldn't be ignoring patient voices because the patient voice tells us a huge amount about healthcare practice, and that research evidence could be derived from a variety of different forms of methods and methodologies, and they each have different benefits in terms of answering different kinds of questions and informing health and medicine in different ways. So at that point, we can really start to celebrate the idea of evidence, in the sense that practitioners' work is guided by a range of different things that can be constituted as evidence. And we can see that the applied nature of that is actually really useful and important. And what happened subsequently was that this idea about evidence translated from the field of health into other areas of applied practice, like schools and education, social care and social work. And now we can see this notion of evidence everywhere. You know, in any field of applied practice, they talk about operating on the basis of best evidence, which again is a really useful thing to have. So the evidence-based movement has really taken control. And it's a global control. We see it in Europe, we see it in America, we see it in Canada, Australia, New Zealand, and all kind of areas of research are now concerned in applied practice with the notion of evidence. But what happened is over time, this notion of evidence started to create discussions about the legitimacy of qualitative research and how useful it was for informing best practice and for guiding practitioners in their work, guiding teachers in their work, guiding social workers in their work. So it started to raise questions about the value of qualitative research and what qualitative research could offer any applied field. And it's kind of created some tensions between the qualitative community and the quantitative community to some extent. We're starting to see some old arguments come back up, where there's now slightly less acceptance of qualitative work than there used to be. I still get asked some really quite daft questions in my teaching and in presentations about, the value of patient voice or the value of children's voices and various other things. And that's because a lot of applied fields now, they really focus on outcomes. And it's not always easy or even possible or even desirable to focus on outcomes with qualitative work. Actually, process matters just as much as outcomes. And yet, the political drive, we see it, we've seen it a lot with COVID, it's all about outcomes, it's all about numbers. And the context and the voice is getting lost amongst that discussion. And over time, what we now have and what we're operating under is this evidence hierarchy. And I'll show you what I mean. So this is a figure taken from a book I wrote, where if you go on Google and type in evidence hierarchies, you'll see lots of different versions of this, but the actual content is pretty much the same. And what's happened is we've created a rhetoric where randomized controlled trials are seen as the gold standard of evidence. And the problem with that is that RCTs are not always the most appropriate method to answer your research question. And yet it's the RCT that is getting most attention. And of course, it depends on what you want to know, because the RCT is an excellent form of evidence for some kinds of research questions, like the efficacy of the COVID vaccine, for example. The RCTs have been really, really helpful. But if we want to understand other issues, like why certain people are so opposed to the COVID vaccine, an RCT just isn't going to give you the answers to that kind of a question. And so we seem to have moved away from the research problem and the research question driving the methodological approach that you choose, to trying to fit in with this idea of the top of the evidence hierarchy. And you can see on the screen that the qualitative stuff is relegated to the bottom of the evidence hierarchy, which is something that frustrates me, because there's a huge amount of value in qualitative work. There's a huge amount of value in listening to children's voices and children's perspectives. And there are policies and initiatives that are designed especially for that, such as child-centered practices and the Children's Rights Treaty. But we're not giving, at least rhetorically, we're not giving quite as much credibility to the qualitative evidence as we are the quantitative evidence. And that's a real shame. And if you're interested, so I'm pressing the wrong keyboard, then we did write a paper where we ranted. We expressed our frustration with the idea that qualitative evidence is at the bottom of the pyramid. Qualitative researchers have fought very hard for a long time to be seen as a legitimate approach to research, to get credibility on teaching curriculums. And of course, then there is this risk that engaging in the inappropriate definition of what constitutes evidence rather than the real definition of what constitutes evidence might put us back, set us back in terms of progress. And so this paper outlines that argument in much more detail for anyone who's interested in that. So there isn't a huge connection between the points I'm making. I feel like I haven't really got the flow, nice flow that I'm always asking my students for in their essays. Where's the flow in your argument? Where's the connection between your points? I don't really have a connection between my points. It's more a series of random rants. But the second issue I really wanted to kind of raise today was mixing qualitative methods. And I wonder how many of you have ever thought about what it means to mix or combine or integrate or connect together in some way two qualitative methods or two qualitative methodologies. or even two qualitative approaches more broadly. And it seems to be that whenever I raise this with any of my students at any level, whether it's undergraduates or postgraduates, or clinical practitioners who I'm working with and training in methodology, most people seem to just think that it's okay. It's perfectly okay to put two qualitative methods together because they're both qualitative. And they can't always work out why I'm even raising this as an issue. Why do you care? What does it matter? They're qualitative. You're just putting two qualitative or three qualitative methods together. Surely there's no problem. But of course there's a problem, otherwise I wouldn't be raising it in this discussion today. It's not a straightforward endeavour to mix qualitatively. In fact, it can be really complex depending on what it is that you're mixing. So most of the mixed methods arguments come from the general mixed methods literature, which is all about drawing on two different paradigms, i.e. mixing quantitative approach with a qualitative approach, with the underpinning idea that you have a greater whole by mixing the sum of the parts. So the general argument is that whilst there is theoretical tension between the post-positivist epistemology of quantitative approaches and whichever epistemological framework the qualitative takes, it can be reconciled through a pragmatism in terms of how you integrate or connect or sequentially orient your data across the two paradigms. And those theoretical tensions have been really greatly discussed, so I'm not going to just repeat those today. So that's inter-paradigm research. But if you are combining qualitative work together, intra-paradigm research, it creates this misconception that it's not problematic, that you can just do it because surely you're operating within one framework. But actually, that's not entirely true, because the level of methodology is different to the level of method. And they actually mean different things. So if you are mixing two methodologies, what you are trying to do is take a synthesized methodologies approach where you're bringing together two quite different approaches to qualitative research. And how possible that is at a theoretical, epistemological and ontological level actually does create some really serious concerns in terms of the quality of the study and the way in which you bring the findings of those two methodologies together. But when you're mixing two methods, i.e. a mixed qualitative method study, the theoretical tension should be resolved at the methodological level, and so it should be much easier to do. So if I explain this, let's see, if you're trying to mix an interpretive phenomenological analysis approach with a conversation analysis approach, then they are two incredibly different theoretical positions. They have different epistemologies, they have different ontologies, they have different approaches to data collection, they have different styles, even in like how and what constitutes data and how you collect it. So phenomenology, for example, tends to favour the semi-structured or unstructured interview, which has to be done phenomenologically to get the depth, etc. Whereas conversation analysis tends to favour naturally occurring recordings of data and actually has a huge problem with interview data as a form of data collection. So how can you reconcile the epistemological tensions of two approaches in one study? And it's not that you can't, it's just that it's very difficult and can't just be ignored, particularly if you're writing a PhD. Bringing methodologies together cannot be and is not a simple practice. Not in the same way that mixing two qualitative methods might be, because mixing interview data with focus group data at least can both be anchored to the same methodology, to the same epistemology and to the same ontology. And so then your issues around putting the two or three methods together is more practically informed than theoretically informed. I hope I'm making sense. It's always strange when you're talking to a screen, because I can't see any of you nodding and smiling, or whether you're looking and going, what on earth is she going on about? So I'm just going to have to assume you're happy and that you'll ask me questions at the end. So again, this is something I've written about. If you're interested or you're planning to do any kind of mixed qualitative study, there is a paper, I believe it's open access, so you should be able to get hold of this one, where we actually give a real example from a project where we did mix the methods anchored to a singular methodology, and we show how that operates in practice. So kind of pedagogical sort of a paper. Okay. So any work I do is interdisciplinary. As I noted at the beginning, I'm very much an interdisciplinary researcher. I personally think it's the best thing to do, operating from various different knowledge standpoints, bringing in different training backgrounds, brainstorming, that kind of dialectical, interesting discussion from different perspectives and backgrounds really can help shape a project right from the beginning if it's done well and it's done properly. And there are benefits, absolutely plenty of benefits. And despite my ranting and despite the issues I have with it, I personally love it. I think it's the best way to do things. Working with others is so much fun, even on Teams and Zoom like we've been doing for the last year. I much prefer to sit around and have coffee and cake and discuss these things, but you know, we're adapting, we're adaptable. But one of the great benefits of doing research in an interdisciplinary way is that you can learn a huge amount from listening to other people on the team. Their expertise, their experiences, their case studies, their practices. It's amazing how much you can learn about a problem that you wouldn't have necessarily even thought of from your disciplinary background. It also means that you can make the research more applied and practical, because if you've got practitioners from whatever background in your team and on your project, then they will say things like, well, that's never going to work in practice, or the NHS is never going to fund that, or it's a lovely idea, but it's very utopian. And they will put you in your place really very quickly, and you can discuss it, and you can look at ways in which you might make the problem go away, might be able to help people in practice. When you've got your data and your findings, they will be instrumental in shaping the analysis and making recommendations for practice and spotting things that have been done really well already and don't need changing. You know, actually, we can learn a lot from best practice that's already going on. There's a huge amount of great practice going on in the health field, in the education field, and other people can learn from that in that field through dissemination practices. So it's a really good opportunity to bring in your practice-based partners, even if they're non-academics. If they're just interested in your research and they're operating as your gatekeepers, I always say, don't just treat them as a gatekeeper. They are a huge fountain of knowledge. So you can listen to them, learn from them, bring in their voices. The other great benefit of interdisciplinary research is creativity and innovation. I have brought things into projects, methods, ideas, new research questions, reading different bits of the literature, thanks to my teams, thanks to somebody in human geography saying, oh, there's a great article in Place and Space. It's not a journal I read routinely, and I wouldn't have heard of it or thought about it, except for my colleague kind of sent me a copy. So it's a great way of sharing, innovating, being creative, thinking through new ideas. And of course, it's an opportunity to mix different methods, because not only do people have different disciplinary backgrounds, they also have different methodological expertise and different preferences for methods and things that they learn. And so they will bring that to the research team meetings, they'll bring that to the dissemination, they'll bring that to the workshops, the writing, and so on and so forth. But there are challenges to being interdisciplinary. I do wonder, if I'd taken a different path, would I now be in a slightly different position with my career? I never know. But there is this challenge, you know, different disciplines use different vocabularies. They use different words to mean different things. Acronyms, oh my goodness. Acronyms, total bugbear. They talk about an acronym that you think you know because you also use the same acronym in your discipline, only it turns out that you're talking about completely different things because their acronym and your acronym are not the same thing after all at all. But there's a real linguistic, language, semantics thing going on when you've got 7 people in a room and they're all from a different discipline, and you have to try and reconcile that vocabulary issue at each meeting. There's also a training issue. People implement methods in different ways. They've been trained in different ways. Their methodological experiences are different. Now that can be a benefit as well as a challenge, but it can certainly create challenges in the way you discuss and go forward. And we're human, and so you have these differences of opinion. We've had a few of those over the years where, you know, I've wanted to do it one way, they've wanted to do it another way. It's about being professional, resolving those differences of opinion and trying to come to some sort of sensible conclusion. But I think the biggest obstacle, the biggest challenge I faced in my career is universities, for want of a better way of framing it. I am interdisciplinary. I do sit across departments and across organisations, and my university just doesn't know what to do with me. In all sorts of ways. A perfect example, our university went on to an electronic system for annual leave last year. So if you want to take annual leave, you fill in the form online and your head of department signs it off. I'm probably one of a tiny number of people in the university who has to submit a piece of paper, well, Word document, to my head of department, because the system can't cope with the fact that I sit in 2 different departments and work in 2 different ways, and it can't possibly have 2 heads of department sign it off. It's far too confusing for the poor little computer. So even like little things like that struggle. In the REF, so universities are judged by the, I think it's still called the REF, yeah, the Research Excellence Framework. And each academic is submitted to a unit of assessment, and those units of assessment represent disciplines. And currently there is no interdisciplinary UOA. So when I come to submit my papers for the REF, I usually have one really great sociology one, I'll have one really great psychology one, I'll have one really great education one. But I can't put all 3 in because they don't fit into one box. They fit into lots of boxes. And people like you to fit into boxes. And I've been resisting sitting in a box my whole career. And I refuse to be categorized in a box. I like being interdisciplinary, but it does create challenges for you as a career. If I was just a professor of sociology, I might get a bit further, but I refuse to believe it. And I was told at my last appraisal that I need to create a disciplinary identity for myself to progress in academia. So I'm trying to work out what that might look like and what that might be. So again, like I said, these things don't necessarily connect together. There is a cohesion of it overall, but I'm going to jump to my next point, which is ethics. So qualitative ethics, again, this is a really interesting thing. So when I talk to my PhD students early on in their proposals, when they're developing the ethics and they talk about the general principles of ethics, very rarely do they say, actually, being qualitative raises these concerns in slightly different ways, or it adds different dimensions to the ethics application, or I need to be more reflexive and think about how the ethics are going to be applied in practice in my project. So just to remind you, generically, most universities, most codes of conduct, most ethical conversations revolve around deontology and the 4 principles of ethics. Now, I do have some issues with that in the sense that there are other ethical frameworks which are also very good, and we just seem to ignore them in practice. But in terms of implementation, these are the 4 principles that generally most researchers abide by. So just to give you some clue, I'm sure this audience knows what these are, but just in case there's someone who doesn't. Respect for autonomy is all about, respecting the rights of the person to make decisions for themselves through the process of consent, etc. Beneficence, which I can never say properly, is all about trying to do good with the research. Non-maleficence is all about avoiding harm. And justice is about equal opportunities in research and making sure that groups are not over or underrepresented or coerced into participating. So this is really important in a qualitative context because the nature of the data collection process, the type of data that are produced through qualitative methods, the interactions between the researcher and the participants, the identifiability of data, all of that kind of stuff is different in a qualitative interview or a recorded observation of a natural event than it might be on an anonymous survey. So there are certain things that a qualitative researcher really has to think about in ways that are different to quantitative. And again, I've discussed this in publications, various other things, but if you are doing something like phenomenology, then depth and richness and the pushing of the participant further and further out of their comfort zone and really encouraging that detail in data collection means that the data you've got is going to be hugely identifiable, detailed, personal, experiential. And so that has huge implications for things like confidentiality and anonymity and data storage and things like that. Also, the researcher isn't hugely involved in qualitative research. You become emotionally invested, you become physically invested, you have a researcher agenda, you might have more than one role, you might be a health practitioner and a researcher. So you've got that dual role, that insider knowledge. And so researcher safety actually really begins to matter, but also the possible undue influences that you as a researcher might have on your participants might push the boundaries of ethicality in ways that is not the case when you simply ask someone if they might fill in a SurveyMonkey online. The other really important thing about qualitative ethics is it's iterative. So again, I'm always reminding students that your ethics doesn't stop at the point where your ethics committee says you can go ahead. Actually, it's really iterative. So a great example of this is my own PhD. We did a family therapy study and we video recorded real world family therapy. And during one of the sessions, I was watching it back, transcribing it and looking at it. And one of the fathers in one of the families turned to the therapist and said, "Oh, is that recording?" pointing to the video camera in the corner. And the therapist said, yes, it is. Sorry, I forgot to check with you at the beginning of this session. Is that okay? And he went, "Oh, yeah, that's okay. We consented. Can you stop the recording? Because I want to tell you something and I don't want it on record." And the therapist said, yes, absolutely. And he turned to the two-way mirror where there's two other therapists sat behind the mirror. And he said, "Oh, can you stop the recording?" And they didn't stop the recording. So I had to raise it as an issue with the therapist and with the ethics. I deleted the part of the video that I wasn't supposed to be able to see. But the point at which they then began recording again, they simply repeated what they'd said off the record anyway. So that was fortunate. But there is this kind of constant checking in. And the fact that the therapist hadn't reminded them for that session that it was being recorded. And I would say that this is, well over 20 years ago. Ethics was not quite as good as it is in the modern day, but it's still an iterative process. It's still a challenge for researchers to make sure that they are constantly, checking consent. It's not a one-off thing at the beginning. It should actually happen at various points through the process as well. And we should be checking back with participants later on with various things. The other kind of key issue is participant visibility. There's a greater risk of identification because rather than an anonymous survey, you might have a video of that person which shows their face, their voice, their gender, and everything else. And that has a huge implication for data management, where you store the data and how you protect the data. So you need to remember that actually qualitative research can be quite intrusive. So it does need to bear in mind various ethical considerations and how you practically apply those ethics. The other thing is an awful lot of qualitative research tends to explore the experiences of more vulnerable groups. And although we must critically question the notion of vulnerability, particularly in applied research, we shouldn't be excluding on the basis of vulnerability. And sometimes we take an over-protectionist position. It still matters in terms of your ethics. But what is really concerning is the position that ethics committees take. So again, one of my PhD students was looking at inpatients in mental health hospitals. And the ethics committee decided that she could only take consent from those patients who had capacity to be able to consent for themselves, which meant that she had to exclude patients who were interested in the research but didn't have personal capacity. What happened was that 2 of the carers for 2 of the patients in that hospital were so annoyed that they were being excluded when they wanted to participate that they wrote to the ethics committee and complained. And they said, you know, that the ethics committee didn't understand vulnerability, and providing the psychiatrist and the carer consented and the patient assented, they couldn't understand what the problem was. So again, we can risk being a bit too protectionist if we're not careful. So we have to manage those issues of power, but you also have to manage the unpredictable nature of qualitative research. It's far more unpredictable than some quantitative work. And again, we talk about some of that in the book, if anybody's interested. So I want to move now on to quality. So we recently, as I said earlier, Jessica and I recently got ranting about quality and the issue around what constitutes a good quality piece of qualitative research. And so we went to the experts, we went to leaders in the field. But just to give you some context of that, there has been a huge drive for standardizing quality in qualitative research, particularly driven by the evidence-based agenda and standardization ideas. And using quality indicators to judge what constitutes a good piece of qualitative research is used in all sorts of contexts, like teaching and supervision and examinations and writing papers and funding and all sorts of other things. And the problem is, for qualitative research, unlike quantitative, there's not a universal acceptance of what the criteria are or what they should be. And this is a challenge. So what we tend to see in the literature is 4 main arguments. There's an argument that we simply take the quantitative markers of quality, validity, reliability, and generalizability. We adapt them and make them fit qualitative work. We create a universal set of quality indicators for qualitative research. So that's things like the QUAHRC. Or we should account for the heterogeneity and diversity in approaches, which is my personal argument. And then there's another argument that actually we don't need quality indicators in qualitative research. So as I said, I'm all for heterogeneity. Each approach has got its own indicators, its own criteria, its own way of recognizing it as a good study. And we need to celebrate that diversity and recognize it. So what we did for our special issue is we went to some of the pioneering people and asked them to write about their own methodology that they were influential and instrumental in creating. So we had Jonathan Smith write about interpretive phenomenological analysis. We had Kathy Sharmas write about grounded theory. Braun and Clark wrote about thematic analysis. Rick Iedema wrote about video reflexive ethnography. Derek Edwards helped write the discursive psychology. And so these people know their methods well, and they created a kind of very basic checklist for each of those methodologies, rather than trying to apply the same checklist to all approaches when there's so much difference between them. And I love this quote, so I've included it. Barber, if we succumb to the lure of one-size-fits-all solutions, then we risk being in a situation where the tail, i.e. the checklist, is wagging the dog, i.e. the research. And the quality thing started a little while ago when we had a rant, and it really was a rant. This is probably the most upset I've ever been in getting a review from a paper. Dealing with reviews is challenging as a qualitative researcher, especially when you just know that your paper has been reviewed by a quantitative person, because they're saying really quantitative things. They've missed the point and they don't understand the methodology. But getting a review from a qualitative methodologist that's missed the point is even more upsetting. And my colleague, Nikki Kiumba, who was then Parker, and we wrote a paper for qualitative health research, and I can't even remember what the paper was on. We submitted it. And it got rejected, and the reviewers had made some points. A couple of them were perfectly reasonable points, but one reviewer had said that we had failed to saturate our sample. Now, the project and the paper was conversation analysis, and saturation is not a sampling adequacy quality indicator for that approach. And so we ranted, and we were upset because the review wasn't very nice. And we ranted and we ranted, and then we wrote some of it down, and then we ranted a bit more. And then we decided actually to look at the review criteria for the journal. And there it was. The QUAHRC checklist should be consulted. But the QUAHRC checklist is for interview research, and our data were naturally occurring events that had been recorded. We hadn't used interviews. So they were inappropriately applying a quality criteria to a methodology and a data collection method in a very inappropriate way. And so we turned our rant into a paper, and somehow this has been my defining paper of my career, the most cited paper I've ever written. But it just explains what the problem with saturation is and universal markers. So if you want to look at the special issue, that's that. So as I come towards the last few slides, another thing I love to rant about, and another thing that gets me upset and riled up sometimes in conversations at conferences and things, is the politics of social science. And what we mean by that is how the wider systemic and structural landscape of research influences and affects the way in which we're able to do our own research as research teams in universities and things like that. So there's a huge amount of challenges for the qualitative researcher, especially given the rhetoric of evidence, given the pressure to produce outcomes. When qualitative research really took off, it was in a climate of increased funding. Where it has suffered is in the climate of cuts to budgets, reduced research budgets and economic pressure. It's quite challenging to get money to do pure qualitative research. It is possible, lots of people do, lots of very good people have, but it has become more challenging, and we see a lot more qualitative research now doing mixed methods projects with quantitative people as a way of overcoming that. But this has implications for the way in which qualitative research is taught, the way it's published, the way it's implemented. But I'm still a big advocate of team working, so if mixed methods is the way to go, then mixed methods it shall be. So what I'd like to do for the last couple of minutes before I stop waffling on to you all is to just give you a bit of an example of how some of these complex issues play out in practice. So I've talked about a huge amount of different arguments, different challenges, problems, barriers, different things that you have to resolve within a project. When you bring all of those things together into one project, it's wonderful and frustrating. It's exciting and very, very difficult. So I thought I would give you this example, which is the World Awareness of Children in Trauma project that's led by my psychiatrist friend, I should say, Panos Vastanis. And I've been heavily involved in this project in helping it out. It's a big qualitative project in Pakistan, Turkey, Kenya, Brazil, and South Africa, where we've tried to do a qualitative multi-method project using focus groups, diaries, children's drawings, and ethnographic observations with 7 to 11-year-olds and 12 to 16-year-olds in some of the poorest parts of those countries, with some of the most vulnerable characteristics and challenging mental health need. We anchored all of that together under a reflexive thematic analysis design. And we have a team that represents psychiatry, psychology, history, human geography, sociology, and the partners who were the leads on the NGOs. And our main focus was on mental health, COVID-19, and resilience. And we've had loads of problems and loads of fun. trying to collect the data from those children in very challenging circumstances with lockdowns and digital inequalities and various other things, but we did do it. And the way we did it was by having very strong partnerships with people who live in those countries, collecting data and helping us to do so. We weren't able to travel to most of those countries because of lockdown and all the rest of it. Mixing the methods proved to be really, really useful because some children really said a lot more in the diaries than they did in the focus groups. Some children really enjoyed the drawings and really expressed themselves through the drawings in ways that they didn't in the focus groups. And other children found the group situation a much safer place to talk. So the combination really did help. The ethics of that was huge, going through each country's own ethical framework, making sure we worked very closely with partners and making sure it was truly child-centered and child-led was fun and interesting to do. So what we did was we basically did research on a sensitive topic with a vulnerable group. We had the theoretical challenges that I've talked about associated with intra-paradigmatic research. We combined the disciplinary perspectives. We used participatory techniques, which is something I haven't really talked much about, in a cross-cultural context. So we had a huge amount of qualitative issues to resolve, but the value of that is that we empowered those children and young people to talk to us, to have a voice, to be heard. We created a listening culture where they mattered, where their experiences were really important, and where the experiential data really shone through. So just to finish, for those of you who are not 20 years into your career and slightly cynical by the whole political landscape and haven't had horrible reviews say really nasty things to you and cause you to rant about things like saturation, I would say, please stay passionate about qualitative research. As you can see, despite everything I've been through my career, I love it. I still think it's the best way of doing research. It's challenging, and solving some of those challenges has led to some of my more interesting publications in the methods literature. Work with others. Don't try and do it alone. You need a mentor. Getting somebody to help you, support you is really, really important. Present at conferences. Have those quantitative people challenge you. It gives you an opportunity to fight back and try to educate them about how important qualitative work is. And get involved with mixed method studies. Mixed method studies are good. You know, it gives a chance to showcase qualitative work. Do lots and lots of reading, and don't be afraid to ask questions of people who've been doing it for longer than you have. Thank you.
Thank you very much, Michelle. Lots of very positive comments in the chat, questions. Thank you very much. That last slide very much is what the QUAHRC is all about. It's trying to provide mentors and support and learning, tips on things to read, podcasts and various things. So do have a look at the QUAHRC website if you're listening to this talk. So Michelle, if it's okay with you, I'm going to lob you a couple of questions that are in the chat. So first of all, it's quite a long one. Annie Irving says, thanks, Michelle. Could you say a little bit more about how you address the issue you mentioned about reconciling different epistemologies and ontologies within different qualitative methods? I realize that's a big question. So to frame it more specifically, using an example you gave, could you say how you would go about explaining, describing, and accounting for differences if you were using IPA and CA within one study? What would you say needs explicating to whom, where in the research process? And what are the practical implications of merging these two methods? Thank you.
That's a lovely long question.
Yeah, a 3,000 word essay.
Difficult one to start with. Yeah, I mean, this is really when you're trying to integrate methodologies. This is the synthesized methodologies issue. It's much harder to integrate methodologies than it is methods, but it's not impossible. So what we usually advise and what we kind of talk about in our book is that you need to stay faithful to each approach because they do have very different theoretical bases. So what we would say is what you're not doing really is integrating, and you're not really mixing in a study. What you're doing is integrating at the end. So you would do your phenomenological study and you would do your CA study. And then at the end, you would demonstrate where there was overlap in the findings and useful messages created from the two projects in an integrated way. Because if you try to mix them earlier than that, if you try to mix them at the data collection stage, you have this epistemological incongruence that is not really solvable. At an ontological level, it's particularly not solvable because of the way in which conversation analysts treat the idea about truth and power versus what phenomenologists treat as truth and power. They treat them very differently. So whatever it is you're claiming can only really represent one or the other methodology. But what you can do at the end of those two small projects is bring the findings of both together, acknowledging the theoretical differences as you do so, and make applied recommendations based on what is really two mini studies being merged at the end.
Thank you very much. I've got a hand up. I'm just going to take one more question from the chat and then I'll go to Megan Robinson. But first of all, Artie asked, really enjoying your lecture. I have some queries. Is it necessary to combine more than one qualitative methods for validation? And could you please throw some light on document analysis? Is there a systematic way to do this?
So it's absolutely not necessary. You can produce a really good project with a single method. And what you have to ask yourself is, what is your question? What is your aim? What is your objective? And who is your population? So it's those things that will determine whether you require more than one method. So for example, if you're, well, for our project, the QUAHRC project, we needed more than one method of data collection because focus groups can be quite inhibiting for some children in some cultures. And with the pandemic and those focus groups running online, we were concerned that we would miss certain children's voices. And given that our goal was empowerment of children's voices, we were already reducing that possibility by just using focus groups. So we introduced other methods of data collection to ensure that the collective group of children were able to be heard. And they were, different children used drawings, different children used the diaries, and different children spoke in the focus groups and spoke out more. But collectively, that data represented all of the children that participated in a way that we wouldn't have had with a single method. However, if your goal and aims don't have that kind of challenge as part of it, if you're, I don't know, interviewing pediatricians about their work or running focus groups with pediatricians to get at a certain kind of question, you might not need to do other methods with those professionals, because you probably will get everything you need from the single method. So it's not about doing it for the sake of doing it. Document analysis, again, that can be another method of data collection, but again, it's driven by your objectives and your goals and your question. So, conversation analysis likes document analysis, discourse analysis likes document analysis, because it allows you to look at the interaction between the text and its intended audience and look at how things are discursively produced and how text is performative. So again, it needs to be anchored to your methodology. But the reason why you're introducing documents either as the sole form of data collection or as an additional form of data collection needs to be rationalized rather than just taken for granted.
Thank you very much. Megan, would you like to ask your question?
Hi, thank you. Firstly, I just want to say thank you for your lecture. It was really interesting. And I just wanted to ask a follow-up question, because I'm asking a similar question to Annie, really. I think my main interest is in how you reconcile different ontologies, because you are exactly right that there are multiple ontologies out there in the world, but I feel slightly, there is some criticism rising of your answer to Annie by saying that you should do the different approaches and then see the overlap to try and synthesize them, because I think there are different ontologies out there in the world and we can't synthesize them necessarily into one universal model that has overlap between all of them, because then you're just replicating the positivist model of science that you're critiquing in this lecture. So I feel we have to be able to hold space for different ontologies in the world, but that's not necessarily by finding overlap and trying to synthesize them. So how in practice do you actually hold space for multiple ontologies? I feel like the ontological turn has had most of its influence within anthropology, and in that triangle you showed of the kind of value of social sciences, anthropology comes last, I would say, because it doesn't claim to be a science. So I think if we really want to hold space for different ontologies, we can't try and make them into a social science, and then how do we do that in an applied setting?
Thank you, Megan.
Yeah, and that is one of the biggest problems that we have, because we're operating in the politics of social science, where we have to compete for funding, where we have to compete for publications, where we're judged by the ref, where, you know, so, and in the applied field, there's an expectation of outcomes and all of that kind of stuff. So on one hand, you've got that, and on the other hand, you've got staying faithful, completely faithful to the parameters of the approach, which is where the ontological argument then comes in. You're absolutely right. They're not reconcilable, not in the sense that you can put two ontologies together and reconcile them. That's not what I'm trying to suggest. What I'm suggesting is that you stay faithful to one methodology and do that project, and you stay faithful to the other methodology and do that project. And even that's problematic, because actually as a researcher, you should have one kind of ontological theoretical basis that you align with. But again, the politics of social science doesn't always allow you to always be faithful to your own personal ontology. So there's already tensions and problems there. But for applied research, the outcome that's expected is possibly a series of recommendations for practice. And that's where you can synthesize, in the sense that you can take what you learned from project A and what you learned from project B, staying truly faithful to those quality indicators, and then create some kind of useful messaging for practitioners. So it's not quite, it's not quite saying you synthesize the ontologies, because you can't. It's about synthesizing the messages developed from the two separated projects. Does that make more sense?
Yeah, I think that's true. And I'm really happy to see these conversations happening in an applied setting. So I haven't really seen that before. And I think it's definitely true to stay true to the ontologies we're studying in our methods. So yeah, thank you for that.
Okay.
Thank you, Megan. Thank you, Michelle. Michelle, we've got a minute over time. I am going to wind it up, but I'm just going to throw one last question at you, if I may. It's from Nathaniel Martin, and he just says, have you seen evidence of qualitative research influencing or changing policy and practice?
I've definitely seen it influence and change practice. I think it's much harder to change policy. It's hard for researchers to change policy anyway, even if they are quantitative. But I have seen instances of it change practice. And I think a lot of that happens at a local level, which is where that partnership working is so important. Because what happens is, if you work with practitioner partners on your project, they take it back to their service and they start implementing it without even really thinking about it necessarily. And I have delivered workshops to services, and clinicians have told me afterwards that they now ask a question in a different way, because the conversation analysis that I did made them really stop and think that actually what they were doing before wasn't the best way to ask those questions. Yeah. So locally, definitely. Nationally, it's more challenging, but yes, there are some there are leading scholars out there who've done that. Policy, it's harder. It's harder.
On that note, we shall close this session. Michelle, thank you very much for giving the QUAHRC seminar. Great talk. Lots of good comments. Excellent talk, amazing in the chat. So thank you very much for that. Thank you everyone for joining us. Thank you for Kate behind the scenes, who pulled all strings and organized everything, and Vanessa Lawrence for leading this team. Yeah, great stuff. Thank you very much for your time. Much appreciated. Bye, everyone. Thanks, Michelle.
Thanks. Bye.